What are some of the most underreported issues in global health? I'm about to speak to some experts to find out more.
I think the single global issue, especially now, is how this pandemic agreement is going to help us prevent outbreaks from becoming pandemics.
I think the workforce we need for global health is just not getting the attention it needs in the countries that we're working where they're most needed. And so we have to rethink how we're training the generation that we need to take over the most important tasks that we know need to be done.
I think we have to be aware of the funding crisis that resulted from the US pullout of global health. We have people who are not getting ARVs, not getting HIV medicines, and they're going to die as a result of this action. And everybody needs to be aware of that because we need to take action right now.
I think noncommunicable diseases, talked a lot about it at this year's WHA, but there's still not enough investment, there's still not enough research around NCDs, their impact, the social determinants of NCDs on populations.
When we are responding to outbreaks and health emergencies, putting children and thinking about children and their needs a bit more centrally in how we do this, not just as a technical thing, actually taking the view of a child and their caretakers and how we can do things in a more humane and child-friendly way would be the thing that I would like to see being done by policymakers responding to health emergencies.
And mental health, again, second, we've heard a lot about it this week particularly. More research, again, more evidence around what works, what doesn't work, how can we help populations. Huge crises of mental health, particularly post-COVID. You need to pay a lot more attention and a lot more quickly.
We need to look ahead of the curve and really, try to address what kind of world and what type of governance with emerging economies, with other countries that are challenging the old order, what kind of interaction we would like to put in place between countries to really forge a more inclusive global health community.
To find out more, subscribe to Devex Checkup, our weekly newsletter on global health.